Hey, this is Ryan Oakley. So you just had a tooth extracted. Let's talk about a few things to be aware of going forward. So first and foremost, initially you're probably numb, so you want to be careful not to bite your lips, your cheeks, your tongue, anything like that. So if you're hungry now, if you could have a smoothie or yogurt or something that doesn't really involve a whole lot of chewing, that would be the best. And then you can get back into regular food once you're numb and you're not at risk of biting anything. Number two, when you have a tooth pulled, for various reasons, it's perfectly normal for things to be sore afterward or for things to hurt a little bit afterward. Typically with extractions, this is something that over-the-counter pain medication handles very well. For extractions, I personally recommend taking ibuprofen. I like 800 milligrams of ibuprofen for myself, and that's what I typically recommend. A lot of people recommend taking 2 extra strength Tylenol with 2 Advil. If we feel like it is something that requires an additional pain medication or an antibiotic, we'll make sure to give you that. Number 3, when we remove a tooth, we're typically placing a socket preservation graft in there and we're doing some kind of stitch. But when you remove a tooth, it's not like if you cut something and then you have a nice pieces that you're able to bring back together. This is kind of a hole that's there that we're putting stitches across. That typically cuts down on the bleeding quite a bit, but it's still very normal if extraction sites seep a little blood even for 48 or 72 hours. So if you do get a little bit of blood on a gauze or something even the next day or so, that's perfectly normal. You should not be bleeding freely. You should not be having a lot of blood, but if there's a little bit of blood, that's totally normal. Because those stitches aren't tight, because they really can't be, it's normal for those stitches to maybe feel like they're a little loose. They sometimes do. Our next appointment with you will be to remove your stitches and to check the extraction site to make sure anything's healing up well. And typically with extractions, there's not a lot of post-operative discomfort involved with it. Usually people kind of get back to normal. For a lot of people though, when we're doing a single extraction, we don't necessarily need to be overly crazy about the changes in our diet. Things that I recommend for people are in the beginning, you do want to take it slow, eat things that are easy to eat in the beginning, but as a few days go on, I would just recommend that we avoid things that are super sharp. Things that are like tortilla chips that may poke that sensitive tissue as it's trying to heal up, different things like that. Obviously, try to chew on the opposite side to the best of your ability. If you have any questions, any concerns, give us a call. Happy to talk to you, happy to go over anything with you, explain anything, answer any questions, just let us know.